Oftentimes when guys hear the word vasectomy, their balls clench and go tighter to their body, which might be good for a Kegel exercise, but isn't great for a successful vasectomy procedure. I'm Dr. Joshua Gonzalez, board certified urologist and sexual health expert. I've performed hundreds of vasectomies, and I'm here today to talk about some of the biggest misconceptions about getting a vasectomy. One of the biggest misconceptions about vasectomy is that it's an invasive procedure, and that's simply not true. Vasectomies are typically a low-risk outpatient procedure. They take roughly 20 minutes, and most of the time they're done under local anesthesia, which means that you're awake during the procedure. Another misconception that guys have is that vasectomy is cost prohibitive, and that's simply just not true. It's actually less than probably a fraction of what you pay for 1 month of rent. And if you have insurance, many insurance companies pay for the procedure. So it's worth checking with them if you're interested in going forward with vasectomy. Another common misconception is that vasectomy is painful, and trust me, I get it. Anybody that has balls knows that even the lightest touch or a gust of wind can cause your family jewels to be extra sensitive. But when it comes to vasectomies, there's actually very little pain involved. Most guys report that the biggest pain that they experience is with the injection of the numbing medication. So as bad as it sounds, it's not that scary to get a prick by your prick. Not only is the procedure itself virtually painless, but the recovery discomfort that men experience can often be managed with over-the-counter medication and ice. Now, a lot of guys think that they're going to be recovering for a long period of time after this procedure, but the truth is, you might be uncomfortable for a couple of days. You might also think that you can't have sex for weeks. The reality is, after just a few days, your sack will be ready to jump back into the sack. Most guys only need a couple of days to recover, but if you have a physically demanding job, you may want to consider taking a day or two extra to yourself. Typically, I recommend that guys wait no more than 5 to 7 days before resuming sexual activity. So if you're okay abstaining for a week, vasectomy is definitely a good choice for you. Now, if you're considering vasectomy, you might be enticed into thinking, well, I could always get it reversed in the future, and that is true, but vasectomy reversal is actually a much more complicated procedure, and it's not always successful. It depends on a lot of different factors in terms of how long it's been since your vasectomy, how old you are, and who the surgeon is performing the procedure. So when you're thinking about vasectomy, I really recommend that you be 100% sure you're no longer interested in any baby making. For guys with female partners, getting a vasectomy is safer than tubal ligation, also known as getting your tubes tied. So chivalry isn't dead, guys. If you're looking for a solution for permanent birth control, be a gentleman. Take one for the team and get it snipped. So I hope this cleared up some misconceptions about vasectomy. It's really a great procedure if you're looking for a permanent way to prevent unwanted pregnancy. And as we talked about, it can take sex to the next level. So if you like the content, make sure to follow and stay tuned for more information from the Dick Doc.